Manger tout manger, ah oui. Pourquoi quitter, non? Parce que je n'ai pas long pour nous en pile.
Maman, ça allait?
Oui, c'est lui-même.
Hello, everyone. Thank you for joining us. Can you all hear me okay? I'll look to the chat bar to make sure everyone's hearing okay. You were able to hear the video okay? I see Susan, you saw that. Great, fantastic. Well, thank you so much, everyone, for joining us. For those of you who are new, that video we like to show because it shows, our mission. Shot at Life aims to ensure children all over the world have access to life-saving vaccines. So through public education, grassroots advocacy, fundraising, we strive to decrease vaccine preventable childhood deaths, and give every child a shot at life, no matter where they live. So today, you're going to hear a lot of great information. This whole week, you're going to hear a lot of great information. So thank you for joining us. My name is Rebecca Maxie. I'm the Director of Grassroots Advocacy here at the United Nations Foundation, and we could not be more thrilled with the week of content that we are going to be able to share with you. So we have over 200 advocates that have signed up to join us this week to learn more about Shot at Life and to be more effective advocates. Over 45 states are here. So if you look around the chat, you'll get to meet other champions from all across the country. But, we're so excited. We have people who have advocated with us since the beginning. We also have a lot of new folks who are joining us for the first time, from different states, different backgrounds, all different org partners. So we're so excited to have you here. And a couple shout outs to our org partners that have worked with us over the years and have brought so many great people here with us tonight. First off, General Federation of Women's Clubs. GFWC is our oldest organizational partner, so we're happy to have you here. NAPNAP, the National Association of Pediatric Nurse Practitioners. AANP, the American Association of Nurse Practitioners. SNAPA, the Student National Pharmaceutical Association, and Nurses Who Vaccinate. So thanks to all of our great org partners for being here today. We're so excited to have you. And for anyone who's new, just know you're going to hear a lot of great information, but you do not need to be an expert to be a champion. We have all the tools and templates and talking points that you will need. So, track your questions. As you're hearing our content, think of great questions. You'll get to meet our team. We encourage you to reach out to us. We're all here to be a resource for you. So please take the opportunity to meet other advocates in your area through the networking sessions. You'll see it's by region. You can chat with us through the chat. You can find other people, ask questions on this. So tonight, you're going to hear from our campaign directors. You'll learn all about our campaign and how to use your voices more effectively throughout the week. We also are very excited to have Dr. Peter Hotez joining us again as well. So we're so excited to have you here. Welcome again. And so, these sessions are going to be recorded. So if you look over to the area where it shows reception, sessions, expo, replay, that replay area is key. You're going to be able to find videos of all this great content. And also, if you have any trouble with Hopin while we're doing this content, please just press refresh. We have found that does solve a lot of the problems. So without further ado, I'm going to kick it over to the campaign directors, Martha Rebour and Cara Ciullo.
Hello to all. I'm sorry my lighting is terrible. I promise I'm usually not a gray human being. So lovely to quote unquote see all of you. Obviously, we miss terribly seeing you all in person. To those who Martha and I know over the years, virtual hugs. And I hope that you're all well. And for those who are new, thank you so very much for joining us. We're excited to have you be part of our team and our campaign. Our grassroots advocates are what it's all about. So thanks so much. I also just wanted to say that the presentation that Martha and I are going to go through, for those of you who've been with the campaign a while, some of it you already know. So I hope you don't mind the refresher. And then as far as those of you who are new, I hope this is good information and that the overview, even if you tuned in today at noon, helps sort of get it all in your head and wrap your mind around who we are and what we're here to do. So to start off, Shot at Life celebrating 10 years of advocacy. It's a big year for our campaign. It's a big year in the world for everything, but it's also a big year for our campaign, 10 years of existence. So next slide, please, Lauren. Thank you. For those of you who don't know, Shot at Life was founded in 2012. And the reason why is because the Bill and Melinda Gates Foundation, as you know, they do their homework. And at the time, they were looking for the best way to invest their money to save the most lives in the world. And after intense research, what they came up with was the conclusion that vaccines were the answer. Get more of the world's children access to vaccines, and many more lives will be saved. So they turned to the UN Foundation. They knew that our foundation was really good at US advocacy work and said, hey, can you focus a new campaign on ensuring that members of Congress are hearing that investing in global childhood immunization is the way to go, and that the federal government should take it seriously and robustly fund the programs. And so voila, there you go. It was the United Nations Foundation and the Bill and Melinda Gates campaign that birthed the idea. Some of our long-term champions, maybe many of which are on the line tonight, were part of coming up with the whole plan to form our campaign. You can see those quotes on the screen are some of Bill Gates' exact words. A best buy in public health, vaccines are, and that they're a miracle, and that we have a shared responsibility to ensure all children, no matter where they live, have a shot at life. Voila, that's how we got our campaign name. Next slide, please. So here's our mission. You can find it on our website and in our materials, but basically it sums up what we're here, what we do, why we exist. We aim to ensure that children around the world have access to life-saving vaccines. We strive to decrease the number of vaccine-preventable childhood deaths and give every child a shot at a healthy life, no matter where they live. So that is the clear mission that we have ahead of us and that we've had for the last 10 years. Next slide, please. So I wanted to give a visual overview. This will be a new graphic for some of our champions who've been around with us for a while. It was my attempt to capture how the Shot at Life campaign works. Here is how we give access to more of the world's children. So what are our campaign's outputs, which essentially means what do we do? What do we actually do on a day-to-day basis? We raise awareness in the United States about the importance of global vaccine equity. We do that to grow the Grass Tops Advocacy Network, and y'all ask members of Congress for strong support of the global immunization programs. We raise awareness to garner civil society and corporate partnerships in support of global vaccine equity. And we do it to increase general public or grassroots understanding of the importance of vaccines and of global vaccine equity. And so then what are the outcomes of all those things that we do? In other words, what are the results of the work? The results of your advocacy work and also of our partnerships with the private sector is that more money is invested in the global immunization programs of our UN partners. Our UN partners who actually are on the ground helping to run the vaccine programs all over the world and get the shots in the children's arms include UNICEF, the World Health Organization, and Gavi, the Vaccine Alliance. So those are our big implementing partners, we call them. The other result is that more people in the United States have accurate information about vaccines. We know how important that is these days, accurate information. And hopefully then we get more people to raise their voice in support of global vaccine equity. So those are the results. But then in the end, the impact. With all those results, the impact is the most important. And that's that more of the world's children have access to vaccines. Let me just dig for 1 second into the why we form corporate partnerships. We do this to help increase awareness of our issue amongst the general public, especially some of our retail partners, another way to get the word out, and also to direct private investment into the global immunization programs that we talked about a minute ago. And the partnership you may be the most familiar with is the one that we have with Walgreens pharmacies called the Get a Shot, Give a Shot initiative. And that happens each fall around flu season. So that one you might have heard of before. Next slide, please. All right, so Shot at Life, what are we? This is the term I've been using a lot lately. If you live in the United States and you want to ensure more of the world's people have access to vaccines, Shot at Life is your portal for action. That's my new phrase that I'm a fan of. You can go right to our website. That's a screenshot on our website, and you'll find various ways that you could take action now. And you'll see that the top selection there, but there's more, is to tweet at your member of Congress. So easy to do, and you can find all the guidance on our website, which you'll see there, shotatlife.org/act. Next slide, please. Okay, celebrating 10 years. So again, I mentioned at the beginning, this is our 10th year, 10th anniversary of our campaign. How has our campaign evolved, and what have we collectively accomplished over the last 10 years? So first, again, some of you who participated in the spring summit, you'll recognize this video, but we love it so much that we thought it would be great to play again. And some of the new people involved will, I'm hoping, feel how infectious your enthusiasm is for our issue. So let's hear from a number of our incredible Shot at Life champions. And please note the video is 4 minutes, so grab yourself a glass of water and enjoy our champions' voices.
I became a Shot at Life champion many years ago, and my earliest memory after I joined was going to Washington, D.C. and seeing these bright green shirts up on the Capitol steps and saying, oh my gosh, I'm a part of something bigger than myself, and something that I can be proud to be a part of.
As a polio survivor, having those flashbacks on how I contracted polio as a child and the obstacles I had to overcome to even becoming a US Paralympian really inspired me to join forces with Shot at Life and use that credible platform to advocate for global vaccines and polio eradication so that no child will suffer or die from a vaccine preventable disease.
An interesting thing about the way we've grown in the last 10 years is this shift in focus from pretty much moms learning to advocate at that first summit to widening the tent. Last time I was at the summit, it was pharmacy students and bloggers and nurses. We need all of these voices together to get the job done. The expansion has been really exciting.
How amazing has been. I have been champion from this campaign from the beginning, in the early stages, and it has been my privilege seeing the growing and the progress that the campaign has done through these years, from 40 volunteers at the beginning to 450 at the end of the first years, champions. Every action that we make and we do matter. Every speaking, every visit to the Congress, every fundraiser is saving lives in other countries.
I've always been really passionate about public health and wanting to help people and do what I can to make the world a better place. And Shot at Life has given me that opportunity to do so and to continue advocating for things that I'm passionate for. Being able to speak to members of Congress gave me more confidence, and it's really given me the push I needed to be a better public health professional and be more vocal about the important issues in the world today.
Hi, my name is Joseph Washington, and I've been a Shot at Life champion for 1, 2, 3 years. And this advocacy experience with vaccines and global health appropriations has impacted my life far beyond simply advocacy. In fact, it has helped to shape my passion for health policy and my interest in utilizing my background in pharmacy and public health to make a tangible difference at home and abroad. And it's for this reason that I owe so much to the United Nations Foundation Shot at Life campaign and all the wonderful champions that I've met along the way.
Again, good afternoon, good evening. I am Martha Rebour. I'm the Executive Director of Shot at Life, and I'm just thrilled to talk to you tonight about where things are, and really thrilled that you've joined us in this Mobilize to Immunize effort, where we will really raise our voices again and make sure that the U.S. is doing its part to robustly fund global immunization programs. So as I said, we all know there have been some real challenges. There's been backsliding. So there's something that we call zero-dose children, and those are children who have not received one single dose of any vaccine. And this has been a focus of the global health community for a while. But what's happened is that number, unfortunately, has increased. We know from 2019 to 2020, by 3.5 million. So there are 3.5 million more children who have not received a single dose. So it went from 20 million to 23 million. And that's very serious. And it's a big focus that we've had, is really trying to reach those children. And we hear about them. Sometimes they live very far away, where it's hard to get to them because of transportation issues, but sometimes they live in inner cities, and they live in neighborhoods and places where it's hard, but that is a big focus right now. So that's one place where there's been backsliding. There's also been backsliding to routine immunization services. And it's not surprising. I mean, even in the US, routine immunization took a little bit of a hit. I think what we're seeing in some of the lower and middle income countries where we work is that healthcare centers had to shut down during the pandemic. It just wasn't safe to be open for a lot of them. A lot of them also suffered from a lack of healthcare workers. Healthcare workers got sick. And a lot of countries we work in, there was not a lot of protective equipment, masks, PPE covering. So there are a lot of there's a shortage of healthcare workers. And then even for those healthcare centers and clinics that were able to stay open, people were understandably fearful to bring their babies in, knowing that they could be exposing them to COVID, and that a lot of people in the waiting room or there were ill. So those are some of the major challenges. And another one that we're going to start hearing about a lot more is vaccine manufacturing and misinformation. So with the exception of India and some in Brazil, almost all vaccines are manufactured in Europe and in the US. This causes some real challenges in supply chain. Shipping the vaccines, obviously it's, especially with some of the newer vaccines that need deep refrigeration, it's expensive and it's a challenge. And it also leaves countries vulnerable. You know, one thing this pandemic has really showed is that Western countries, wealthier countries, have tended to hoard the doses that they have, having millions and millions more doses than even they would need to cover their entire population, and leaving behind the rest of the world. So the US has made some really important commitments recently, but we're still a long ways away from where we should be. So I think it's a real priority, and we're going to see that when we talk later about the global sort of collective priorities coming out of the pandemic, but certainly diversifying manufacturing, making sure that it's not just happening in wealthy Western countries is a really big goal. And then, of course, vaccine misinformation and distrust of science. So you're going to hear a lot more about this from our friend, Dr. Peter Hotez later. So I won't go into it too much, but I did think there was a finding from the Rockefeller Foundation that was particularly interesting. And they said the COVID-19 pandemic is laying bare a hard truth. Facts alone are not sufficient to drive behavior change during a crisis, but misinformation that plays on emotion is. And they cite a study in the journal Nature that showed even brief exposure to misinformation made people less likely to want a COVID-19 vaccine. So I won't get into the big debate that just was opened up again last night for 60 minutes around Facebook and some of the roles social media companies have had, but I do think it's critically important to think about this role that misinformation has had, because we did know going into the pandemic that there were a certain amount of people who were what we would call vaccine hesitant. But I think what we've seen from some of the misinformation that's happened is that those people, it made them even more hesitant, and they didn't seek out where they were seeking out behavior. They were seeing misinformation, and we all need to make sure we are filling that vacuum and making sure we're talking about pro-vaccine stories. We're talking about the safety and the efficacy of vaccine. So if I could move on to opportunities, please. Excellent, thank you. So I have to say that obviously lots of challenges. I think we've all been challenged by this pandemic, but at Shot at Life, we see some really good opportunities too. We must take this moment of tremendous attention on vaccines and really leverage it, because there has never been this many resources and attention about the power of vaccines to prevent disease and avoid illness and death. I think that we've seen a real tangible reminder of the importance of vaccines and strong health systems. And it's interesting because I think most people in the US, a large majority, hadn't really experienced an outbreak or a pandemic or really seen much in terms of infectious disease. And now so many of the things that we have been saying for years, vaccines don't respect borders, we must strengthen health and immunization systems around the world to protect ourselves. Vaccine equity is not only morally, but also strategically imperative when it comes to combating the spread of infectious disease. And just that we're all in this together, right? I think if there has been any silver lining to the pandemic, that's maybe one of the biggest ones, that we all depend on each other. And I think we really need to make the case that global childhood immunization programs, the ones for which we've been advocating for 10 years now, have also laid vital groundwork. And we think of this a lot with the polio program, but a lot of other work that's been done, which is really set in place an infrastructure that the global health world can build on to respond to this pandemic. So whether it's laboratories for testing, it's training healthcare workers, there's a lot of foundational work that thankfully was done combating other infectious disease that's really being recognized right now. So I think we feel like there is a lot of opportunity. And then the other one is there's just been incredible advances in vaccine science. So we've had a unique moment where scientists around the world were collaborating. We know we came to vaccines faster than anybody ever thought could happen. And then the mRNA technology alone, we're going to see hundreds of new vaccines coming to the market and developed thanks to this technology. So we do think there's some really great opportunities. Next slide, please. So where we think it's really important to take this is advancing this cause of global vaccine equity. And to do this, we know countries are going to need to ensure availability and training and proper compensation for healthcare workers, and they're going to need to invest more in infrastructure. Next slide, please. And thankfully, there is a plan. The world has a plan and has come together, and that plan is called Immunization Agenda 2030. So this is the path forward, and it's a global roadmap around vaccines for all people of all ages. And it was developed with input from civil society groups, a wide range of people from around the world. And the number one priority is making sure that immunization programs are there, strengthening. There's primary health care, so ensuring that there is a good investment in primary health care, and immunization is the foundation of that, the sort of the block underneath it. And then there needs to be leadership, governance, and management. We need to have an environment that allows for effective coordination, financial management, and performance monitoring. We talked about the health workforce. We need to make sure there's adequate training, on time, and appropriate compensation. There needs to be, and I see that we're getting closer on time, so I don't want to get too much into the details, but we know there needs to be investment in supply chain and logistics. We need to strengthen supply chain so that high quality vaccines are always available in the right quantity and form at the right time, in the right place, and that they're stored and distributed under the right conditions. We also need to do surveillance. It's really important to not only the contact tracing, but showing when there have been outbreaks, and really having a tight surveillance system. We all know that is a really key part of how you eliminate disease and start to respond to outbreaks. And then also monitoring vaccine safety, and then also disease control initiatives. So I'd like to show a short video about IA 2030. And after that, we will have remarks from Peter Hotez. So if you could please roll the video.
Today, I fight to give all the world's people access to vaccines because I have seen firsthand the importance and health impact of medical outreaches. It is no doubt today that the COVID-19 pandemic has truly highlighted the importance of giving every individual, regardless of where they live, access to life-saving vaccines, which are an integral and proven tool in preventing the spread of communicable diseases like COVID-19 in our ever more global and connected world.
I believe the vaccines save lives and save money. Do you know that over 7 million children in Nigeria that are born every year need vaccines to stay alive, especially for preventable diseases? Imagine these children not vaccinated. It will be terrible. Children are our foundation. Vaccinate them and do not allow them to be cut off.
वैक्सीन ज़िंदगी बचाती है और हम सब मिलके ज़्यादा से ज़्यादा ज़िंदगियों को महफूज बना सकते हैं। आइए इस मिशन में मेरा साथ दें, ग्लोबल इम्यूनाइजेशन एडवोकेट बने, ताकि सेहतमंद माशरे की तश्कील में कोई भी फ़र्द अपनी एज, जेंडर और सोशल स्टेटस की बुनियाद पर गैर महफूज ना रहे।
Okay, well, thank you, Martha, and thank you, our famous Shot at Life champion, Joseph Washington, who's featured in most of our videos. And I hope you enjoyed that last video. I have the honor to now introduce Dr. Peter Hotez, our keynote speaker this evening. Dr. Hotez is, I think many of you will agree, the sort of person who makes you wonder, how on earth does he have time to do all of this? In addition to being a physician and a scientist in neglected tropical diseases and vaccine development, he's a husband and a father, a researcher, an author of more than 500 original papers and 5 books, all of which are really interesting. He just released one recently, so I'd recommend it. An ardent vaccine champion, a fighter against vaccine misinformation, a science explainer who is on TV several times a day. I know I see him several times a day. And for many years, he's been in the fight to give more of the world's people access to life-saving vaccines. The other thing I love about him is he has no problem speaking truth to power. If you are a global health and vaccine nerd, like many of us at the Shot at Life campaign, Dr. Hotez is one of your heroes. I know he is mine. I'm not sure how he got so lucky, but he lists Shot at Life as one of his favorite organizations and is kind enough to spend some of his very limited time with us. One quick note that we wanted to mention before Dr. Hotez begins, for those of you new to the campaign, please know that he may use some global health and vaccine science terms in his presentation, like many of our speakers at our conferences. And that's perfectly okay that you don't understand what those things mean. You don't have to. We don't expect you to become vaccine scientists. What's important is that you get really excited to add your own unique story to our collective call for all the world's children to be given access to vaccines. So it's going to take all of us together with our unique voices to have our voices heard on Capitol Hill. And with that, Dr. Hotez, I hand the mic over to you.
Well, thank you for the opportunity to address the Shot at Life Summit, an organization that I follow very closely, and I'm so grateful for all of your contributions. Just a word about who I am. I am a MD PhD laboratory investigator who develops vaccines for neglected diseases of poverty. And our center, which is part of our National School of Tropical Medicine, where I'm a professor and dean, is co-headed by myself and Mary Elena Bottazzi at Texas Children's Hospital, my science partner for the last 20 years. And I've spoken before to this group about our vaccines for parasitic infections and other diseases of the poor. But around 10 years ago, we also began developing coronavirus vaccines because we found that they were similarly orphaned. And at the time, not many people cared about vaccines for SARS and MERS. But that allowed us to hit the ground running in terms of developing a COVID-19 vaccine at the beginning of 2020, because we had done a lot of work showing how to deliver the spike protein and finding that the spike protein is a target for coronavirus vaccines. And I'll talk a little more about that. But I want to kind of zoom out first and tell you where I think the global landscape is headed for vaccinating the world, both against COVID and really all diseases, including childhood infections. And it's a very mixed picture right now. There's no question that through the work of Shot at Life and especially the Gavi Alliance, the Global Alliance for Vaccines and Immunizations, we've made some extraordinary gains, at least up until the time of the pandemic. I mean, the numbers are just incredible, right? I mean, talk about success, 87% reduction in number of kids under the age of 5 dying from measles or pertussis or tetanus or diphtheria or bacterial meningitis. These are numbers that have come out of the Institute for Health Metrics and Evaluation in their latest iteration of the Global Burden of Disease for 2019. By the way, those pictures on the right, which you can download from the internet, are by the very famous Brazilian photographer Sebastião Salgado, who spent time going around the world photographing kids getting their vaccinations, mostly the polio vaccines. And they're a very moving set of images, I think, especially the looking at the expression on the parents' faces, everything from hope to joy to fear. So this is where we were pre-pandemic, and unfortunately, we've had some setbacks, and this is why your advocacy is so important, because in part of the social disruptions that have happened during the pandemic, including here in the United States, together with the rise of anti-vaccine aggression, which I'll also talk about, we've had some interruptions in our ability to vaccinate the world's children. And I am worried about breakthrough measles and pertussis and other childhood and ancient scourges. And this is why we're at such a critical time. I'm really worried that we could reverse so many of our extraordinary gains that so many people have worked so hard to win. These are hard-fought gains, and we don't want to let those slip. So this is a key message here, that we have to redouble our efforts to make certain that we don't lose ground on our ability to vaccinate the world's children. And then, of course, with the Delta variant itself, this is causing devastation around the world, with some projections that by the end of 2021, we'll have lost more than 6 to 7 million lives from COVID-19. And the problem, as bad as it is in the United States, this is what we're facing globally, where the African continent is, for all practical purposes, unvaccinated, not doing that much better in Southeast Asia and many parts of Central and South America. So we still face glaring global inequalities and inequities that we have to address, and that we are so far failing to vaccinate the world's LMICs, the low and middle income countries. And this is what I think is especially important, to really articulate the scope of the problem. And I'll call your attention to the bottom part of this slide, where we have more than 1 billion people in sub-Saharan Africa, 650 million people in Latin America, another 500 million in the smaller low-income Asian countries. We're talking 2 to 3 billion people, 5 to 6 billion doses of vaccines, maybe up to 9 billion doses if we give 3 immunizations. And here's the problem. We don't need this by 2023 or 2024. We need this now. We've got to get out 6 to 9 billion doses of vaccines for COVID-19 now. And this is not something we can afford, because we've seen not only the humanitarian impact of letting so many people suffer from COVID, but also the fact that we've already learned that the B117 variant, the Alpha variant, arose out of an unvaccinated population in the UK. The Delta variant arose out of an unvaccinated population in India. And almost certainly this is asking for additional devastating variants to arise. And one of the contributions that we're making is we were able to flip our coronavirus vaccine program into making a low-cost, durable recombinant protein COVID-19 vaccine comprised of the receptor binding domain on aluminum hydroxide, an old school adjuvant, together with a TLR9 agonist, the CpG, and it's been highly effective in non-human primates, looking great as we move through phase 3 trials. And the hope is that this vaccine will help fill the gap because of the problems of scaling mRNA vaccines and other vaccines now, because it's a brand new technology. Having an older technology seems to work just as well. That could be scaled for the world because it's the same technology used to make, for instance, the recombinant hepatitis B vaccine that people have been giving to their kids for decades. So it's really specifically designed for low and middle income countries. So I think we need other alternatives to help fill this gap so we can vaccinate billions of people now. And in India, where we've licensed it to Biological E, one of the big vaccine producers, it's known as Corbevax, and looking very exciting. We're also have licensed this to Biopharma in Indonesia to make a halal version for Muslim majority countries. So we're hoping that this can move pretty quickly. If it's released for emergency use listing in India, then globally this fall. Now, the other problem that we face, of course, is that we are seeing other forces that are bringing back diseases. And this is the latest book I've written called Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. And a lot of it was written even before the pandemic. And it basically said that we are at risk of losing our gains for vaccination, often because of things that as biomedical scientists or as physicians or healthcare providers, we don't ordinarily think about, such as poverty and war and political instability and urbanization, deforestation, climate change, and this very aggressive rise in what I call anti-science. And this may be one of the deadliest forces of all. I thought it'd be worthwhile just briefly recounting the history of the anti-vaccine, anti-science movement, how it began as version 1.0 back in the late 1990s, claiming that the measles, mumps, rubella vaccine and then thimerosal-containing vaccines caused autism, and how we were able to push that back and combat it, although the threat is still with us today. Then the politicization of the vaccines that happened starting around 2015 with the health freedom movement, and how this has become a globalizing and very deadly force that's interfering with the work of Shots at Life and our work as well. So the 1.0 is that the false claim that vaccines cause autism, and it started with claims that the MMR vaccine, measles, mumps, rubella, did this, and our community of scientists went to enormous lengths to debunk that, showing that large cohort studies showing that kids who are on the autism spectrum were no more likely to have gotten MMR than kids not. And then similarly, kids who get the MMR vaccine are no more likely to develop autism. That was a lot of hard work. And the problem is the anti-vaccine groups kept on switching things up. So they would move the goalposts. In other words, we would debunk the fake links with MMR vaccine. Then they say, no, it's the thimerosal preservative or spacing vaccines too close together, or alum vaccines. And I know the people at Shot at Life have been really on the front lines trying to keep up with all of the fake assertions. And it's even gone over, of course, to the HPV vaccine for cervical cancer and other cancers with false claims that it causes infertility or autoimmunity. And by the way, if that sounds familiar with the fake assertions about COVID-19 vaccines, that's where they got it from. They would just copy paste the fake assertions about other childhood vaccines or HPV vaccines and put it onto COVID-19 vaccines. And of course, I got involved in this because I have 4 adult kids, including Rachel, who has autism and intellectual disabilities. And a few years ago, I wrote a book called Vaccines Did Not Cause Rachel's Autism, which does a deep dive explaining the science, why there's no evidence showing vaccines cause autism, and why there's evidence showing clearly that vaccines do not cause autism, but also what autism is and how it begins in early fetal brain development through the action of more than 100 genes. And I talk about how with Rachel and my wife Ann and I, in case you're wondering what my home studio really looks like, you can see it's a very elaborate setup with the laptop on the box of seltzer there. How we did whole exome sequencing on Rachel and my wife and I, and to sequence her genome, and we were able to identify one of the 100 genes involved in autism. And of course, the anti-vaccine groups were not very happy with me, and now they've publicly labeled me the original gangster villain. So that's also interesting. So Shots at Life has invited the original gangster villain to speak with you today. But in any case, we started making progress on debunking the autism links, but then the anti-vaccine groups had to re-energize. And the way they did it is quite interesting. You know, as the anti-vaccine movement spread to California, by 2013, 2014, we had large numbers of kids denied access to their vaccinations in Orange County, and this predictably led to a terrible measles epidemic there. And so what the California legislature did, which was appropriate, is they shut down they shut down the vaccine exemptions for non-medical reasons. But this inadvertently also triggered a version 2.0 to re-energize the anti-vaccine groups under this banner that they call health freedom, medical freedom, saying, hey, government can't tell us what to do. And it really accelerated in Texas, where now we have over 70,000 kids denied access to their vaccinations, and many more who are homeschooled kids. And it's especially terrible around the suburbs of Austin and up in North Texas. And again, it's this health freedom, medical freedom banner, which is now unfortunately in 2020, 2021 extended to masks and social distancing and now COVID-19 vaccinations. So it's created this very clear partisan divide in getting vaccinated. Here's an example, for instance, for the state of Texas, although the New York Times has recently put out an article called Red COVID to show how this partisan divide and people tying their allegiance to political extremism on the right includes defying vaccines, which is so obviously self-defeating, but that is the reality. So here in Texas, for instance, you can see that the higher levels of vaccination in the urban areas along the Mexico border very much go along a blue-red divide. And we have, according to the Texas Health Department, we have some counties in the rural areas of Central Texas or East Texas where essentially no one is vaccinated, with devastating consequences. We've now lost 100,000 Americans to COVID since April, May, despite the abundant availability of vaccines. It's people losing their lives unnecessarily because of vaccine defiance. This is how dangerous this anti-vaccine, anti-science movement has become, and it's become global. So we've exported this to Canada now. There were just recent anti-vaccine protests across Canada in the last few weeks, again under this banner of health freedom, medical freedom. It's gone to European capitals, and the New York Times and BBC have even reported it's linked to QAnon and political extremism on the far right, even neo-Nazi groups. So it's really taken this very dark turn, and this is the three pieces of the anti-vaccine movement that I've identified. It's far right-wing extremism and even political action committees on the far right that lobby state legislatures. We've got state actors now. It's been reported by US and British intelligence that the Russian government under Putin has been waging this war using what's called weaponized health communication against vaccines. And now the Center for Countering Digital Hate, which is a new organization, and it's amazing we have to have an organization called the Center for Countering Digital Hate, now estimates there's about a dozen non-governmental organizations they call the Disinformation Dozen that has about 60 million followers. So this is the three-headed monster that we need to battle. So I know there's a lot of evidence, a lot of emphasis on the social media companies and their role in disseminating this, but I think there's even more to it than that. It's really getting to the sources of the disinformation. And I've been writing and speaking about this and making the case that, you know, we put a lot of emphasis on building infrastructure to combat things like global terrorism and nuclear proliferation and cyber attacks. I make the case that anti-vaccine, anti-science aggression is every bit as potent or more potent than any of those forces. And we have to look at how we can counteract that in new and innovative ways. So thank you so much for the opportunity to speak with you, and I look forward to following up, and congratulations again on your Shot at Life Summit.
Great, that was wonderful. Thank you to Dr. Peter Hotez. We were so happy to get to have him here with our champion. Some of you may remember him from a couple of years ago, and I'm sure you've seen him on the news. So we were very excited that he's been such a great supporter of the campaign. So thank you to Dr. Hotez. We're wrapping up. I know we're running a couple minutes over, but just a few quick notes. One, if questions come up while the conference is going on or anything from tonight, I recommend that you email us at champions@shotatlife.org. We're monitoring that all the time. We're happy to help. We'll also have office hours with the team coming up Friday from 12 to 1 p.m. Eastern time. So we'll give you more information on that. But you're welcome to join. And also don't forget that you can hit the replay and go back and watch some of the content if you missed it. This week, we are very excited. We have a lot of content coming up. Next up tomorrow at noon, we'll be talking about a global perspective, COVID-19's impact on immunizations. Followed tomorrow evening at 7 p.m., we'll be doing a session with some great global health and nurses in our champion community, all about using your voice and communicating effectively with Congress in your community. You'll also hear from Brian Massa, who will help you a lot with our specific asks and a lot of great information when we're doing our advocacy. So we're looking forward to that. On Wednesday, we'll have some more workshops. So at noon, it will be all about how to get published in your local paper. You'll have our comms team, and they'll be doing a workshop to help walk you through that and help you get started on that. It's a lot easier than you think it is, so we encourage you to join. And then 7 p.m. on Wednesday evening, we will talk through all of the great things you can do with your advocacy and really how you can be the most effective in making the most out of every single piece of advocacy that you do and every action that you take. So we're looking forward to that. And then we'll wrap up on Thursday. We'll have a phone bank at noon Eastern, which we encourage you to join. We'll both talk through doing a phone bank. We'll actually make some calls, but we'll help you figure out, how to bring this home to your own communities when we do our call-in days around World Polio Day. And then we will wrap up with some great content and some surprise guests tomorrow and all throughout the week. Actually, we'll have some great surprise guests for you to hear from, wrapping up 7 p.m. Eastern on Thursday. So we have great content coming up, great team members, both internal and external. You'll get to hear from everyone, some wonderful special guests that you'll still get to hear from. So thanks again to all of you for joining us tonight. We're excited to see you tomorrow at noon. And again, remember, if you miss any content, please feel free to join us on the platform and replay those videos. You can also reach out to the team at any time at champions@shotatlife.org. So I wish you all a good rest of your evening, and we will see you tomorrow. Thanks again, everyone.